Hi guys, it's a concerned Dr. Miskoff, and it's about 9:30 p.m. on May 8th, 2020, vlogging on COVID-19. And tonight I wanted to go back over allergies. I had the day off and was outside and noted almost immediately that my eyes were more red and itchy, watery. I started to get some sneezing and nasal congestion. And I get it every year around this time. Looking at the tree pollen counts, they are at a moderate high level, although the grass pollen and the ragweed are low or non-existent. Currently, I think we're going to see a peak of the tree pollen around Mother's Day this week, coming up on Sunday, and then it'll kind of wax and wane throughout the season, and then we'll see an increase in grass pollens and the ragweed, of course, as we get into the summer months. But I want to reassure everybody it is common to see allergy symptoms right now. Shouldn't freak out and worry that every symptom that you get is COVID-19. Fever is a concerning one. We don't usually see that with allergies. So any healthy person, in my opinion, that's getting a fever, even as the numbers drop down, I would still be worried. Of course, you can get fevers with UTIs and other upper respiratory syndromes and infections. But fever would be one that would certainly not be common in allergies. You can get sneezing, you can get runny nose and nasal congestion with allergies as well. Rashes and hives tend to pick up. And in more severe cases, you can see diarrhea, vomiting, even with allergies. We have seen a subset of the COVID patients get diarrhea and GI upset, even vomiting on occasion. I've seen a case of perforated bowel with COVID. So everything is possible, and I'm sure we'll see case reports of dermatology with COVID. And I've heard at least anecdotally, oh, this patient had a rash or so, and then they may have developed COVID after that. Could have been coincidental. It could be allergies mixed with it, or it could be stuff that we haven't figured out. We know in the kids, some of them are presenting with a Kawasaki type syndrome. Unfortunately, I think one was lost in New York City. There was, I believe, a report of about 15 of them, and a few of those on ventilators with the quote mysterious illness. And many of those had tested positive either by nasal swab or immunoglobulins for COVID, but I don't believe all of them had. So there will be dermatologic, derm type of manifestations that are reported, but in general, you can see these things with allergies on a more common basis. You can even get swelling of the tongue. Again, cough can overlap with infection and allergies, but often an upper respiratory or clearing of the throat. Again, if it's something that is associated with high pollen counts and you have a seasonal allergy, it's probably that. Keep your eye on more ominous symptoms like the fever if you're worried more about COVID. Of course, with allergies, you can get fatigue and not feeling well, but with COVID, we have seen people that are just wiped out from it, and that's a little bit different. Chest syndromes can occur with either. Clearly, if you have chest pain and it could be cardiac, you have to notify your healthcare provider or get to an ER. But with allergies and COVID, we've seen different chest syndromes. COVID can have pleurisy, as we know. They get these peripheral infiltrates, or as we call it, ground glass opacities, and those can cause a pneumonitis or inflammation, and even a pleurisy or what appears to be an inflammation of the pleura as well. Sometimes in really bad allergies, these patients will admit to a feeling of impending doom. Again, the tree pollen counts seem to be up high. It looks like they'll peak around Mother's Day. The ragweed and grass hasn't kicked in yet, and we'll see that more throughout the summer. Hopefully, we continue to see a drop in the COVID-19 numbers. I'm hoping and hopeful that we may even see a drop down to almost no admissions for COVID in the next few weeks, getting into the hotter months. As long as we see it trickling into the ER, even a case a week or a case every few days, I'll have concerns that it returns in the fall months. But for now, time will tell, and hopefully we continue to see a drop in the numbers and in the death rates, of course. Everybody stay safe and have a great night. If you have any concerns, whether this is allergies or COVID, reach out to your provider and stay well. Thank you.